Hi, and welcome to the September episode of More or Less. I'm Peggy,
And I'm Cody.
and today we are talking about physical therapy because October is Physical Therapy and Occupational Therapy Month.
And this episode is brought to you by Baker Orthotics and Prosthetics. We are here for all of your orthotic and prosthetic needs. Please give us a call today at 817-332-7313. And Peggy,
Yes,
I cannot emphasize enough what the importance of physical therapy is to our patients.
I want to talk about that. I think that a lot of patients and a lot of especially new amputees do not understand the importance of physical therapy, but we'll delve into that as we have our discussion a little bit.
There you go.
Um, yeah, so let's talk from a clinical perspective. What do you see in the office as the benefits of a patient who goes through a physical therapy program?
Well, let me go back just a couple steps and just explain kind of how you get there and then what they're going to do for that patient. So, we will have a fitting process where that patient is cast and delivered with a prosthesis. And then we will refer them over to physical therapy after giving them just a minor bout of, gait training and explanation on just how to use the prosthesis at its fundamental rudimentary level,
Mhm.
right? The physical therapist, however, is going to open up a whole new world of functionality for that patient. The reason is that when we have a limb loss or limb difference, our bodies are using a lot of compensatory mechanisms, or, we're using a lot of muscles that don't normally get used to control a mechanism like walking. And those muscles need to be trained on how to make up for the loss of the leg. So we've got core muscles that are involved. We've got hip muscles, back muscles, all kinds of things that um, need to go into the process of walking now, whereas they were not in the past. So what the physical therapist is going to do for that patient is train those muscles for strength and flexibility, so they're strong enough to carry out all of those odd motions that they don't normally, do during the gait process, and give that patient the ability to move about in their space. They're going to provide balance and coordination through those mechanisms. They give that patient a lot of exercises that they can do even at home and to carry on through their life and the journey with prosthetics, to be able to utilize that prosthesis to the fullest extent that they can. Everyone is different. We all have a different level of amputation. We have a different physiology, um, biomechanical makeup, everything. And we all need something that is custom tailored to each one of us as we move through this. Physical therapy for we'll call the able-bodied person, you can kind of go through some of the same motions with everyone and go, okay, well, this injury requires this, that injury requires that. With amputation, again, everybody is different, and we're going to have a lot of different anomalies, um, comorbidities, things that are going on with our bodies in other ways, um, diabetes, high blood pressure, vascular issues. We may have been in a car accident where other limbs are involved. We may have to have a brace on the opposite side. You name it. There's a whole plethora of different things that go into making up our custom tailored recovery process, right? So the goal is to reduce, pain, reduce any inflammation that may come, the swelling that comes. The goal is to increase our balance, our functionality, our coordination, our strength, so that when we are walking, we are doing so in the safest way possible, so as not to further injure our bodies. It's like when we tell people bend at the knees to pick up a heavy load, not with your lower back.
And I'm going to
Um,
interject real quick because when you're
yeah,
saying not to injure our bodies, it's in the present, but physical therapists are also looking in the future, right? So they're the ones who are going to tell us, don't hop down the stairs, or make sure that you do this to help protect your other joints.
right. Exactly. So, as you move throughout the day, you don't want to tweak a muscle or, fall inadvertently when you could have gone through that motion with a physical therapist to understand what does it mean to put weight through my prosthetic foot
Hmm.
when I walk up a step, when I go down a hill, when I walk on the grass, etc. They're going to give you the ability to stand on uneven surfaces, um, and create instabilities in a safe environment so you know how to handle them.
Exactly. Just to be clear, what happens with patients between the parallel bars during delivery? That is not physical therapy,
That is not
correct?
physical therapy.
Exactly.
No. The
I
the
think a lot
the
of patients consider that as their physical therapy.
no, no, that is the initial instructions on how to basically maneuver the prosthesis through
Right.
the swing phase of gait and plant it on the ground in the most rudimentary safe manner you possibly can. We try to
Exactly.
we try to nail, just or hammer in that feeling of this is what your foot feels like on the ground.
Hmm.
Make sure it feels like that before you put weight on it.
Right.
Not now we're going to go down the ramps. Now we're going to go over the stairs. Now
Exactly.
we're going to, and we're not going to work with you on your core. We're not going to work with you on all of your other um, extremities so that you're strong in those ways as well. But we will work with the physical therapist as much as possible to get you there. We can even bring the physical therapist into the office if they are able to and have time, and we can discuss back and forth how we work with the patient. We can visit the physical therapy department, and definitely open up some of the capabilities of what a prosthesis can do for a patient. Remember, the prosthesis is a tool. Okay. It is a tool that is only as good as the person wielding it. Okay.
Exactly.
And I say it like this, you can give a hammer to a 3-year-old child, and what are they going to do with it? They're going to hit the wall and make a hole in it and not really use that hammer to the best of its ability. But if you train that child up and they use that same hammer years down the road, they can build a house with it,
Right.
right? And do it quickly, and effectively. So, that's what the difference of physical therapy is. Just making sure that you are controlled and careful and also capable.
Exactly. I want to add just a little bit of a personal perspective on physical therapy as you were talking. I think it's also a great way for patients to be able to gauge their own recovery and own progress through physical therapy. It really helps kind of an emotional and social well-being that when you're in that recovery phase, it's really easy to kind of retreat into yourself and onto your couch and kind of hide from society during that recovery. And physical therapy, I mean, it pushes you to leave your house and to go somewhere and to be active. And from a personal perspective, my mom is recovering from surgery and is going through physical therapy for her knee. And I think it's helping her as much emotionally as it is physically at this point because it's forcing her to move. And I'm seeing the benefits not only physically, but emotionally. And I think that the same is true with the limb loss community.
Absolutely. I mean, for myself, personally, I've gone through physical therapy. I've done it multiple times in my life,
I
actually.
wanted to ask you, so you kind of are, I put you in the realm of congenital, right? Because
Yeah.
it's infant up. Okay. So when did you first, I know you're getting specific with me. When did you first have your first physical therapy? Do you remember?
I was probably about 8 years old when I remember
Okay.
the first time I went to physical therapy. I was given TheraBands, which is these rubber band things, and they give you resistance so that you can move in different, planes of motion. And, one bar of weight isn't going to necessarily allow you to do all different kinds of things that you need to do with your hip joints and motions in a 360-degree environment, right? So I was early on trained that this is the right way to walk. This is what you should be feeling. This is what your foot
Okay.
feels like on the ground. And these are the muscles you need to be firing as you take a step through. And
How did
whenever
you feel doing that as a kid? Do you
it,
remember?
yeah, I do very much so actually, because my therapist looked like Santa Claus and I was very intrigued by that. But no, I was I was intrigued by it to a degree. At being 8 years old, it was like, oh, this is interesting. I get to put rubber bands on my legs,
Hmm.
and I was able to just feel like I was taking control of how I would walk because I fell every single day. Now I'm,
Oh,
a little bitty
right.
kid, and so falling is literally going down to my prosthetic knee and then getting back up. And I did it
Hmm.
so often that I just did it and did it and did it and did it. Like it was rote in behavior for me. But once I was able to really learn, okay, this is what balance is. This is what control is. I fell less and
Hmm.
less and less over time. But had I not been trained, these are the muscles that are keeping you upright
Right.
now that you don't have your, abductor muscles, which are the ones that keep your torso over to the side. If I'm wanting to not lean this way, abductors push me back over that way. You know, uh, I would have, just kind of flopped around, if you will. I
Hmm.
don't know how else to put it. Just wildly swung my leg, through the gait cycle, which is pretty much what I did. Of course, at the time, the knee mechanism was a door hinge. It was just a
Right.
floppy, thing. But I had to compensate for that as well. And we all have to compensate for the technology that we have. There are certain technologies that will provide for less compensation, depending on what kind of control they bring to the table as a tool. It's let's just say it's a bit easier to use a power drill to drill through something than it is to crank it by hand.
Right.
That makes sense. Okay.
Absolutely.
There you go.
I gotcha.
So, but then, I had to go back through physical therapy later on in my life when I injured my lower back doing some yard work. And I had to really focus on a lot more core work so that when I would move with my prosthesis, I wasn't just utilizing um, some of the tertiary muscles that were closer to my extremity. You want to really control your core because when you control your core, all of your extremities get much more coordinated and balanced. Your
Right.
arms, your legs, everything just kind of comes in line.
It's called the core for a reason.
It's called the
Go
core
figure.
reason. And I felt a lot more confident
Hmm.
and safe in what I was doing. So it opened up a lot of ability for me
Great.
and
So,
endured ability, I should say as well.
um, I I did not have any kind of formal physical therapy
And you're
after
not
my
alone in that.
amputation. I am not alone in that. I asked for physical therapy. It was denied, which is actually one of the reasons that people are not getting the physical therapy in the limb loss community. And honestly, at that time, I if I knew now what I didn't know then, if I knew
You
then
knew
what I
then.
know now, you know what I
There
mean.
we go.
Something like that. I would have fought. I would have fought for it.
Mhm.
I didn't have any fight left in me, Cody. I
Mm.
was so drained at that point. I had fought for so long against every establishment that they were like, nope, you don't need physical therapy. You got your leg, you'll be fine. Like, all right, peace out. So
Wow.
now, since then, I've been really, really fortunate that I've met some wonderful physical therapists and have picked up tips and tricks and along the way. But I would encourage anybody, don't be like me. I mean, seriously, if you're recovering or you feel like you will benefit from physical therapy, go ahead and make the call. I mean, there are so many benefits, right? So I wonder why isn't everybody doing it? So when I was doing some digging, there are basically three main reasons. that people in the limb loss community haven't done physical therapy. The first one being financial. Physical therapy is expensive. It's covered by insurance, not always at the same rates. You have co-pays. Sometimes you only have a certain number of visits, whatever it is. Unfortunately, we understand money gets in the way of it at times. There are some different avenues that you can try to go to. You can work with your physical therapist. Some of them have sliding scales. Some of them will accept payments. So if you feel like you really do need physical therapy and finances are what's keeping you back, I encourage you to reach out to the physical therapist and have that discussion because they might have some resources available to help pay for that.
Yeah.
Second reason that people are not getting physical therapy are classified as logistical, and that's proximity to a physical therapist or not having one available. So I did some digging, Cody, to find out basically how many amputees last year, new amputees, received physical therapy. And in rural areas, so that's out in the country, only 30% of amputees received any kind of physical therapy. As they get farther away from a city center, that number actually it decreases. So your chances of getting physical therapy as you get away from a city center decreases. If you live in an urban area, 73% of those amputees receive physical therapy. Why? Proximity. It's right there. If transportation is an issue, there are some grants. We're going to link to them in this podcast, and you can find the information on the Whole Person Network as well that can try to pay for that to get you to and from the physical therapy when you need to do it. There are Uber grants. There are some different patient grants that can be used to pay for it. And then the third reason, I think I'm going to let you take the lead on this one, Cody, is just personal. I think it kind of just lump
Yeah.
everything on, I don't have the fight or I don't know that I need it.
Right. And I think that what's happened is physical therapy has been underemphasized, and the importance has really not been explained very well to the patient population. Just like you were told, and that was 2003, right?
Yes,
Yeah.
20 years ago.
So wow, 20 years. I'd say congratulations, but it's not something to, celebrate, but it
I
is.
get a cupcake every year anyway, so it's all
Yeah,
right.
there you go. But even at that, what I would say modern age of society,
Mm-hmm.
we didn't understand the importance of physical therapy even then, as a
Right.
whole. It just really needs to be hammered into the population that our bodies are not, infinite. One, and there are so many aspects to healing, and our bodies all heal differently, and there's so many aspects to functionality, and we all don't function the same. And you know what we are not doing as a, how should I put it, healthcare community, is tying the patient's health into one whole package, right?
Absolutely.
We're saying, well, we've taken care of this problem, so we're good.
Mm-hmm.
But
We're still so compartmentalized.
oh, very
It's I
much
take
so.
care of this, you take care of that. And that's not how our lives are, right? We're a mixture of everything, but our care is not.
Exactly. And even the understanding of how to work with amputees amongst the physical therapy population, it's very limited. I mean, I know that we go to physical therapy schools here in the Dallas-Fort Worth Metroplex, and we train those physical therapists for a few days on how to
Mm-hmm.
work with amputees. Will many of them see an amputee during their care? Not really. Like there's only a few physical therapists that actually see amputees. And so what we find is that, we'll probably have like someone in an area that specializes with amputees,
Right.
and they take most of them on, and so we try to funnel them toward that person. But we do try to reach out to the physical therapy community and bring them in and train them as a group, and provide them with education units and all the things they need, to be able to work with amputees as technology progresses, as technique progresses, and the better understanding of what amputation or limb difference does to a person's body.
And the surgeries are always changing. The
Oh yeah,
amputation surgeries themselves are changing. So,
exactly.
yeah,
I mean, now we've got osseointegration, we've got, that where, the whole prosthesis is anchored to the bone. That's new.
mhm,
Who knows about how to work with that? What muscles are affected there? We've got new socket technologies coming out all the time. How is the leg suspended on the body? We have new knee and feet technologies that come out all the time. Powered prosthetics are now available. So we're introducing the quadricep and hamstring muscle function back into the gait cycle where that's never been done before.
right.
How does a physical therapist adapt to that? And so we have to be there on the front lines, as the front runners in the prosthetics health field, to better train and educate physical therapists on what is new, up to date, the standard, and what looks right, what is absolutely appropriate. And then, on the other side of this, there's also the patient that is just afraid to go to physical therapy.
Yeah, it's scary.
It is scary. They're afraid to put themselves out there and be told that they're not living up to some standard that
We're
they've,
afraid of falling. It's as
or
simple as, "I'm afraid I'm gonna fall."
they're afraid of falling. They're overwhelmed, like you said, you didn't have fight left in you.
Mhm,
They've just been through a traumatic experience.
and depression
And
will keep you away from a lot of things too.
exactly, exactly. And, we really want to make sure everyone understands that that physical therapist, that prosthetist, that team is there to help you, not judge you. They want
Right.
to give you all the tools that you need to be successful in the space that you live in. Whether that's, you stay around the house or you want to go out into the community and shop and dance and do whatever you do, or you want to go and climb that mountain. Whatever it is, they want to get you there and find the solution that makes that possible. But it takes more than just, here's your leg, see ya, bye,
Right.
have a
It's a
good day.
process. You have to work at it.
Absolutely, it's a process. It very much so is. And real quick, I want to go back before we close out and touch on a couple of things. Um, in regards to some resources, real quick. I want to touch on one group that, I think everybody should really look into if you're an unfunded or underfunded individual. When you don't have insurance, there's a group, and I'm sure we're all familiar with GoFundMe and how that works and everything. But there's an organization called Help Hope Live, and they are out of Pennsylvania. They're a national organization. They work very much like GoFundMe does. The difference being that all funds that they raise or you raise, are funneled toward your diagnosis, and they're held in such a way that they do not affect you financially, so they don't change your tax bracket like GoFundMe would,
Right.
and the funds are held for your lifetime. So no matter what, if you raised $100,000 and you needed 30 of it right now, 70 would sit there until 20, 30, 40 years from now. It's still available to you. Though that those funds go toward anything regarding your diagnosis, and that means your transportation to get to your medical appointments, your physical therapy, your ramp at your house you need when you get a wheelchair, anything surrounding
Mhm.
your diagnosis, it's going to pay for it. Okay, so that's one. The other is if you do live in an urban setting and you haven't been told yet, most of the time, and you'll want to look into this, there is a medical transportation line, and it is deeply discounted. I've ran into a lot of people who have not taken advantage of it, and I've had to
Yes.
tell, there's a medical transport, you don't got to pay the premium rates, they will come and help you out. So do look into that for the area you live in.
And we do have those resources on our Whole Person Network. So if you are interested in learning more and having access to those resources, we encourage you to talk to your prosthetist about joining our network.
Yeah, and I encourage you to go get physical therapy if you haven't done
Yes.
so yet. And if it's been a while and you feel like you are out of shape or you feel like you're just not where you want to be, go have an assessment done
Yeah.
and see if
Yeah.
there's something that can be done. And it takes work.
And if you don't know where to go, start by calling your prosthetist.
Yes.
Just say,
Start there.
hey, I feel like I need physical therapy. Where would you recommend? Your prosthetists are going to know the professionals in your area who specialize with amputations. They're going to know the ones that are up on the technology. They're going to know the good from the bad. They're going to set you up for success. So don't be afraid to make that call.
Absolutely. Um, and remember, it takes just standing up, walking out that door, and walking back into the physical therapist. That's all it is.
Yep,
It's nothing, there's no judgment. Nobody's out to get you, and they only want to help. So do this for you first and
perfect.
foremost. Do it for
Absolutely.
you and make sure that you take care of you. Because when you take care of you, then you can take care of others and you can really be an asset to your community.
Absolutely. Cody, it is great seeing you.
It is great to see you too, Peggy.
And we will touch base next month, October already. Can you believe that?
It's amazing.
I know. Time's going so fast.
Flying by.
All right. We'll talk soon.
Talk soon.